Now, while those dramatic events were being carried out at the Labor Party caucus room and afterwards, not too coincidentally was released a rather damaging report, at least financially damaging report, on the impact of a national dental health scheme. In fact, a national dental health review has recommended the federal, state and territory governments invest more than $10 billion extra to fix the system.
The report by the National Advisory Council on Dental Health says too many people have poor oral health, despite big improvements over the last 30 years. For more, the Greens health spokesman Richard Natale joins us now from Canberra. Good morning to you. The Greens have been calling for a Dentacare system for some time now. This would obviously give this more impetus.
It sure does. We're thrilled with the report. The report basically confirms the Greens' vision for Dentacare, which is that we need to work towards a universal dental care, so that going to the dentist is just like going to the doctor, where you have your dental care funded through Medicare. And so that's the ambition expressed in the report, something that we share. It does make recommendations for a significant investment in dental care, but remember that $10 million is over the next 4 years, and there are huge costs associated with not doing it. At the moment, we have people who go to general practitioners. I was in general practice, and 1 in 10 visits were from people who couldn't afford to go to a dentist and ended up with infections and pain and so on. A lot of people end up in emergency departments, about 60,000 each year, and about $2 billion in lost productivity. So there's a huge cost already on the health system. And so we've got to take that into account. But yes, it is expensive. We're a wealthy country, we can afford it. It's about priorities. So we're really pleased that the report has expressed what we've been saying for a long time, which is that we need to aim towards universal dental care, so our scheme's called Dentacare, and that we need to make that investment now. And so we wholeheartedly endorse the recommendations in the report.
Are you sceptical about the timing of the release of this report?
Oh, look, it was very disappointing. People can draw their own conclusions. To be released at 5 o'clock yesterday, one would assume that it's going to attract a lot or less coverage than it would otherwise. But look, it's just nice to be talking about policy. This soap opera's gone on for so long. I'm just really pleased that we can talk about something that matters for a change, and what matters is the dental health of the Australian community, and what matters now is that the government get on and implement these recommendations.
The Health Minister, Tanya Plibersek, has already indicated that the government won't be able to implement all these recommendations immediately. Have you had a conversation with her, and what was her response?
Look, we've spoken a few times on this issue, and she's expressed her commitment to want to improve the dental health of Australians. Now, here's the opportunity to demonstrate that commitment by putting her words into action. The report doesn't say that a massive investment should all happen at once. It says we need to do this over the next 4 years, building up over time and working towards universal dental care, much as the Greens have been saying now for some years. So I say to Tanya that she needs to adopt certainly year one and make a commitment that over the forward estimates they'll fund what's recommended in the report. Because
how confident are you that that's actually likely to happen? This government is very committed to bringing the budget back to surplus in the next financial year.
Look, that's going to be a decision for the government. I mean, the Greens have always said if we had the original mining tax proposal, we'd be able to fund Dentacare, we'd be able to put more money into public dental education, and we probably have some spare change. So it's a question of priorities. And for the Greens, whether we have a small surplus or a small deficit in this year's budget is much less important than beginning the transformation of the healthcare system so that we have everybody being able to go to a dentist and being able to afford it. In a wealthy country like Australia, having a situation where almost half of the community defer going to the dentist because they can't afford it, and then imposing huge costs on the health system down the line, it's not good enough, and we've got to start making that transformation now.
So in terms of the actual, what's the reaction that you think dentists will have themselves?
Well, I'm really encouraged that the dental profession and certainly the Australian Dental Association have said that we should have affordable dental care, particularly for people on low incomes and kids. And the report recommends that the first priority is for all children, so universal care for children, and also for anybody with a concession card. And that's a really good place to start. The Australian Dental Association have said they're behind it. They were in fact part of this advisory council. So I'm confident that the dental profession will get behind it. We know that a range of social justice groups who are also in the council have got behind it. People, oral health hygienists and so on. And of course a number of academics and professors who work in this area have all made this recommendation. They've all been part of it. The Greens wholeheartedly support it. Now it's really the job of government to get on and implement it.
Richard Di Natale, thank you very much for joining us this morning.
It's a pleasure.